The summer before my 8th grade year, a week before we were ready to go to nationals, I tore my right ACL. And so a friend of mine told me I should probably go to Campbell's clinic because she went there and it was really nice. And so I ended up going there, and Dr. Azar was my doctor. Well, I'm a crier, so I cried. Dr. Azar handed me tissue. I'm a little bit dramatic too, so it was a big ordeal. And first I thought, well, I'm not gonna get to go to nationals. And then I'm like, I won't play basketball anymore. Because when you think about ACL, you think about just a career-ending injury. The second surgery I had was when I tore my left ACL, and it was harder than the first one just because I just got told that I would be earning a starting spot. And basketball was something I honestly loved, and it was my passion. And I knew that I was in the best hands, and once the surgeries happened, I was ready to go play again. My third surgery with Campbell's Clinic was when I tore my Achilles. After I had surgery and I went through rehab, I was walking around again, I felt normal again. I realized I don't want to stop playing basketball. I have a career interest in orthopedics because I know without Dr. Azar at Campbell's Clinic, then I wouldn't be able to continue to do what I love, or even walk or wear heels again. I'm gonna go to prom and I want to be able to wear my pretty dress and my pretty shoes and walk around pain-free.
The educational part has to do with residency training of medical students, primarily fellows.
I did an away rotation at Vanderbilt, and I did another one up here at the clinic, and just kind of fell in love with the model. So you have part of the private practice, you have part of the academics, and the whole thing. It starts with Azar from the beginning. Faith, family, orthopedics is what's important. So,
well, it's really a unique transformation. It's a 5-year training program to go through here. Very fortunate we attract the best and brightest medical students, some of the smartest ones, because it's very competitive to get into orthopedics. And we can train them to practice good medicine and to have good skills in the operating room. But at the end of the day, we're looking for the character of the person that walks in the door that wants to be a resident here. The research really transcends all across orthopedics, whether it's sports, spine, pediatrics, hand, foot. Some of it's basic science, some of it's translational. There are a lot of opportunities out there for research, and we like to say we want to play to our strengths. In this area, we have great support for basic science, we have great support for clinical research or translational research, and what we try and do is take what we learn in the lab and apply it to the patient. There's a tremendous legacy here for community outreach. It goes back to our founder, Dr. Campbell, with the crippled adult clinic and the crippled children clinic. It started with that, and it's really been carried forward.
I wanted a little something else in my experience, and I wanted to be able to see medicine in a third world environment where you don't have all the resources that we have here. So the foundation was gracious enough to start this international scholarship elective fund, and I was fortunate enough to be the first resident to go. I was awarded the scholarship, and I went down to Managua, Nicaragua. And I kind of participated in everything. And so I did some stuff in the clinic, I did a lot of surgical operations, and I also did some consultations and some overnight call activities too. We did nailing of tibia fractures, we did hip fractures, we did some hand machete wounds, we did radius fractures, and then we also did some knee arthroplasties as well. Here in surgery in the United States, the representatives from the surgical implant companies have rows and boxes of shelves, whatever size, shape, anything that you could need. When we were in Nicaragua, we could pick from 3 different sizes and 5 different screws. So it really makes you appreciate the kind of wealth and resources that we have here in the States. To give a young physician the opportunity to see what it's like to practice medicine outside of the United States. Not only does it make you a better clinician, makes you a better surgeon, but it makes you a better doctor. This trip was so important to me that this is how I'm going to be giving back to the Campbell Foundation in the future.
We couldn't do what we do without the foundation, the support of the foundation.